trouble. I don't come to doctors unless I need the doctors.
I stabbed it with a needle last night.
Why did you do that?
So I cleaned the needle first. I licked it.
I have a lady who is 24 weeks pregnant. She's got this sort of 12-hour history of right lower abdominal pain. The thing that worries me about this, though, is that it's coming with reduced fetal movements.
How are things? You're looking very young now.
No, I need to die in Italy.
I mean, the back has been a problem since 1984. I was lucky enough to be involved in a train crash.
Breasts getting larger?
Yes, they are.
Yeah, he's trying to beat me.
Yeah, you're not in for disappointment in this clinic.
Morning.
Hi, Barbara.
Hi.
How are you doing?
I'm all right, you?
Not too bad, thank you.
Good morning, Final Row Surgery.
Elizabeth Buchan, please. Hi there, Elizabeth. Come in.
I've had a really bad back. I suffer with
Yeah.
my back quite a
Yeah.
lot. But Saturday, I started playing about with some cushions.
Yeah.
And something, just like a spasm went off in my back.
Uh-huh.
And then Sunday, it just got worse. So I went to A&E. They said that I've got a trapped nerve.
Yeah.
I'm not able to go to work.
Yeah.
I tried to go this morning. I've just been sick everywhere.
Right.
Really dizzy.
And are you sort of feeling dizzy just sitting still or when you move or?
All the time. I just feel really spaced out, really tired.
What I'm going to do is I just want to have a little look in your ears, do another test, and then we'll look at your back. That's okay. Yeah, that's okay. So when you feel dizzy, do you just feel lightheaded or a bit spaced out?
I've just been sick 3 times.
Yeah. So follow my. I'm going to move my finger quite quickly, but what we want you to do is to follow it for me as best you can. Okay. Does any of that make you feel a bit dizzy? I can tell because your eyes are flickering when they go this way.
Okay.
Let me just have a quick look at your back then and see.
Yeah.
Logan Reed. Good morning, Logan.
Morning.
Hello. All right, what's wrong with you then?
He's had a temperature now for a few days with a little bit of a sniffle.
Yeah.
But he's started to get this cough now, so and because of all these other issues, I thought I'd just get him checked out.
Do you want to take your jacket off and let's have a listen to your chest?
He's had a temperature. It's not been sky high. It's like been 38.7.
Okay.
So it's not.
Is
massive.
epilepsy well controlled?
Yeah, it seems to be at the moment.
There we go. Listen to your back. Crystal clear.
Okay, that's good.
Okay, I suspect it's viral. Most of it is at this time of year.
Yeah.
Which will cause him to have little spikes in temperature and things like this. Paracetamol, as you would normally take, regular fluids.
Okay, excellent. And one of his ears is hotter than the other one. Which one was it, Logan?
This one was hotter than that one.
Yeah.
You wouldn't get a different temperature because of anything.
Okay.
This is not going to work. It's not been working for 2 weeks. I don't quite know why.
Battery's changing?
Maybe. I think it might be the bulb.
Yeah, maybe the bulb's gone.
Right.
Right, let's hope that it is the bulb.
Yeah.
And not the whole thing's completely blown.
Do you want to stand up for me? It needs new batteries. Yeah, right, here we go.
Yeah, normally the lump has to touch the
Yeah,
little metal bit, but the thingamajig has to touch the thingamajig.
Right. We got a light, I think.
Oh, that's good.
Put your head away for me. That is absolutely normal.
So look at the other side.
Your brains haven't fallen out then, Logan.
No, that's all. There's a bit more wax on that side, but that's also normal. I think this is just a little viral cough.
Okay.
You're fine. Off you go.
Good.
Take it easy. See you later.
Thank you very much.
No worries. Bye-bye.
Now, let me just have a quick look at your back then and see.
Yeah.
Don't think this is related to your back now.
Okay.
Okay.
Yeah. The pain is right
Here, yeah, okay.
but it's going
Up here. Oh, wow. These are really tight, aren't they?
Yeah.
Okay. Can you bend even further forward or
I
no?
can bend right down.
Yeah,
It
but you
feels
can't come
actually
back.
nice.
Yeah. Okay, that's good. Just sit yourself down. Okay, I'm not entirely convinced that you've got a sort of trapped nerve.
Okay.
Because normally you'll get the pain going down your leg as well.
Okay.
But also, normally sort of bending forward will make the nerve more painful.
Right, okay.
So we can give you something to help relax the spasm. Now, the dizziness and sickness, when I'm getting you to move, you're getting some flickering of the eyes. Now, that's which we call nystagmus, which just means flickering the eyes.
Yeah.
It usually means that there's possibly some fluid in the inner ear that is causing you to be dizzy and sick, because you've got a balance mechanism in there, and there's a little ball floats on some fluid. When you get more fluid in the ear, you can get more fluid in here, and the little ball doesn't respond quite as quickly as your eyes do when you move, so your brain gets 2 signals instead of 1, and it makes you feel dizzy and you can be sick.
Okay.
Now, I am going to give you something to help with that, as well as the back. Are you just taking the cocodamol?
I've got diazepam, so I took it once, and because I've got a little boy, and
Yeah.
it was just me and him,
Yeah.
it knocked me out.
Okay, try half now. If there's somebody around that can look after the little one, just in case it does zonk you out, that would be helpful. And keep taking your cocodamol and the naproxen as they told you. Okay.
Thank you very much.
Okay then.
Thank you very much.
Bye-bye.
You're not busy now.
No.
You having a cup of tea?
Yeah.
2 biscuits.
Good.
Do you want to come and work here? Do you want to come and work here?
No.
Tanya Williams. Just caught my shirt. There you go. Come and have a seat down there. How you doing? All right. So, what's been happening?
I was at work yesterday.
Yeah.
I do office jobs, so
Yeah.
I'm sat down most of the time.
Yeah.
It's about 10 o'clock in the morning, and I noticed a kind of like a dull ache on, like, right underneath here.
Okay.
And I kind of thought, I'm 24 weeks pregnant, so I thought, oh, my trousers are too tight.
Yeah.
So I undone them, and I was like, oh, it'll go. Had
Okay.
my lunch, I thought I might be hungry.
Okay.
Didn't go, so I thought, okay, take some painkillers.
Okay.
The ache's still there, but now what I'm getting is more like a period pain, kind of really intensified, just on my right-hand side, to the point where I was literally in tears this morning. Like, it was so painful.
Any discharge or any blood?
No blood. Discharge, I think, normal.
Have you started feeling movements yet?
Yeah, past 3 weeks or so, it's been kind of crazy.
Okay.
Feeling it kind of...
Still the same since yesterday?
Not really.
But much less than normal?
Yeah, less than normal.
Okay, fine. What I would like to do is have a quick feel of your tummy and have a quick listen if I can find the Doppler. I'll be back in a second, okay?
Thank you. It's really hurting.
See my hand, right? Sometimes that I can't bend it, the middle finger. I can lift anything, anything.
Yeah.
You know, anything.
Yes.
But trying to hold a pen,
Yes.
it's really painful.
Yeah.
My finger. Look at it there, it's all white. At night time, it feels something's drawing out of it, and the pain is shooting in there.
I've had this about 2 years. You know, when you go to wash up, I knock it. Oh, I can't count how many times.
Put your finger in there for me. Yes. Lovely nail varnish, but do you have one without nail varnish?
Yeah.
Ah,
Lost
perfect.
it this morning.
Perfect.
I even, be honest, tried to pop it, and all that came out was all gooey stuff like glue. It was really weird. I thought, oh, I'm not going to do that again.
David?
David Wallace?
Oh, sorry, yes. Hi, David. Come in. Have a seat, please. All right, how can I help you, David?
This one.
Yeah, I remember I saw you the weekend, isn't
Yes, Sunday.
Not got any better?
With that medicine, what's it called?
Yeah.
The fluoxetine.
Okay.
Mind you, I stabbed it with a needle last night to try and get rid of some of that, but.
Why did you do that, David?
Well, because it was filling up. Because it was like this. I need to to get rid of it.
Is it painful?
No. At first it was throbbing. Boom, boom. That throbbing is gone.
Okay.
But if you touch it or push it or whatever, then it hurts.
Okay. It looks it's got worse since I saw you. You should never do it by yourself because there's a risk of infection.
I cleaned the needle first. I licked it. No, I used hydrogen peroxide to clean it with.
You should never do it. I think I told
But it was getting worse, though. What can I do?
I know. You should have gone to A&E then. Or you should have come to us.
I'm here. If you've got a sharp knife, you could do it right.
No, we don't do it that.
You're not squeamish, are you?
Why?
Well, with all the stuff coming out, we could... No. Okay.
David, I don't know how busy you are. Are you able to wait for some time in
Yes,
the
I am.
waiting area? Because I will see if one of my colleagues can have a second look at it as well to see if we really need to send you to the hospital or if we can do it here. All right?
Yes,
okay?
fine, yeah.
All right, I'll see you soon, yeah?
Yes,
okay.
So let's have a quick feel. Do you feel it worse when you're walking?
Yes and no. It is. I've got just a dull ache, but it's literally right there.
Sounds okay. I'll just give you some tissue. Okay, so where you're tender when I'm examining you, it seems more likely to be like a ligament strain. But the way you describe it doesn't quite fit, especially because you haven't been feeling the movements as much. Just do your blood pressure first and just make sure everything's all right from that point of view as well. Let's turn around. All right. Oh, hi there. Could you put me through to maternity triage, please? So I have a lady who is 24 weeks pregnant at the moment. It's her second pregnancy. She had preeclampsia in her first. So she's got this sort of 12-hour history of right lower abdominal pain, and her blood pressure and things are all okay. The thing that worries me about this, though, is that it's coming with reduced fetal movements. But her fetal heart sounds are about 130 when I listen, so it sounds more reassuring. Does she need to come in for a CTG with yourselves, or what do you think? Okay, fine. All right, that sounds good. Thank you. Cheers. Bye. Okay, so what they've said is they want you to take two tablets of paracetamol and call them in 2 hours if you think things are not settling. Okay. If it is settling, it's probably just the ligament pain, and they're less worried about the fetal movements.
Yeah.
Is that okay? So I'm just going to write it up in your notes. Okay, so 2 hours' time, if you're thinking I'm not heading in the right direction, I want you to call that number there.
Yeah.
Tell them that this was the plan that we've made, and we'll see how we go from there.
Cool. Thank you very much.
Hopefully, it will settle. No problem. Take care.
Cheers.
Okay.
Thanks
a lot. See you then.
Thank you.
Bye-bye. Bye-bye. Oh, look at you in that coat.
He's a cutie.
Do you feel better now?
Yeah, he's much better. He was really bad, so the doctor was worried about it. But...
There we
Put
go.
your foot down.
There we go.
And smile. Yes.
We're going to numb it by putting anaesthetic in your finger, and then as soon as it's numb, we're just going to stick a knife in there. Is that okay? And hopefully that'll make you feel a lot better.
Thank you very much.
It's on the left hand middle finger.
I love your shoes. I really like them. I've been looking at them as you've been walking up and down the stairs. They're nice. Quite a well-dressed, and I believe you're a runner in your spare time.
No, I'm a cyclist.
A which?
Cyclist.
Okay.
That's disappointing, yeah? Are you a runner?
Yes.
See, I tried to let you down. Yeah. I'm going to sit you over here. Is that okay? So, and put your hand on there so it's comfortable. That's it, yeah. Okay, you ready?
Yeah.
Just look away. Okay.
Oh, that was okay.
It was okay?
Yeah.
That should be the worst bit. Should be.
Does the sight of blood bother you?
No. Are you okay?
Yes, thank you.
Yeah. Don't look at it.
Can I look at you instead?
If that helps you, that's fine.
How's your finger feel?
No.
Okay, if you mind just lift your finger up for me. Put your finger down. Okay. One more look away. Does that feel?
I can't feel anything.
Okay. No. Right, so that's how it looks now.
Mm-hmm.
Letting the pus out should let everything else settle down.
Not much came out.
There's never as much as you think. It's always disappointing. You always think you're going to be going under the stuff.
I thought it would be.
Yeah, you hope, yeah.
A little fountain.
So this is the most challenging bit for the doctors, because of course we're rubbish at dressings, and the nurses are fantastic.
Oh, well.
Okay, so...
Is that why you're not a nurse then?
That's why I'm not a nurse, yes. I had to settle to be a GP because I couldn't do the dressings, yes.
I can put... Oh, can you close that door, please?
Hello. Come on in and have a seat.
Morning, Dr. Bolger. Morning.
How can I help you this morning?
First thing is, I've had very, very dry ears for
Oh, you have, haven't you?
3 months.
Have we tried anything?
Well, we tried Vaseline, a nurse recommended.
E45, and we've been trying them on coconut oil.
Coconut oil, OK. Very inflamed, very angry. I think maybe a touch of some steroids might help with that, some hydrocortisone. It may well be that that makes it much better, and then you can just carry on with the E45 until it goes. If it makes no difference at all after a fortnight on the steroid cream, can you come back and let one of us have a look?
Yeah.
Yeah.
OK.
The second thing is, do you remember we had this big discussion about why I was on testosterone?
No, I don't remember. Remind me.
He was having injections regularly, and then we were told that something had changed and we had to see Dr. Jiwanji.
Who's the urologist?
Yes. It was Dr. Jiwanji that stopped it. I can't remember now.
So why was it for?
I suddenly was getting very, very sore nipples, and I was scratching them. In the end, I was making them bleed. It's come back now, actually.
Low testosterone can cause a variety of symptoms. It can cause problems with sex drive and with sexual function, fatigue, weight gain, problems with hair loss, and it can cause mood disturbance and also sometimes sleep disturbance. Low testosterone isn't generally thought to be a symptom of more serious conditions, and it's recognised that testosterone levels do tend to fall generally in most men from middle age onwards.
And did you have blood tests that showed low testosterone levels?
I must have.
Yeah, I think you did, didn't you, at the time?
Right, OK. Is there anything to see at the moment? Is there any inflammation or redness?
There's only a slight bit of redness, and that's probably been me scratching.
Scratching. Breasts getting larger?
Yes, they are.
Yeah.
They are?
Yeah.
Right.
He's trying to beat me.
There's no answer to that.
No competition.
Can I have a look?
Yeah, sure.
Right, it'd be worth checking your levels. That's all fine. There's no untoward lumps or bumps there. That's good. Testosterone is sometimes given by urologists, and I suspect that when we were a bit nonplussed about why you were taking it, that's why you saw Dr. Jiwanji. We have the electronic records, obviously. It might be that actually we need to get your records up from out of storage to have a look if it will let us from then.
That should break the porter's back.
I'll need a wheelbarrow just for yours.
Yeah, just for his.
If we start with some blood tests, and then when they come back, maybe if we say we'll meet in a couple of weeks' time, it'll give me a time to have a look through. And then I think if your testosterone level is low, then it might well be worth thinking about asking an endocrinologist to see you and giving us some advice.
OK, lovely.
And obviously when I see you in 2 to 3 weeks' time, you can show me your ears as well.
No, lovely, thank you very much.
I look forward to that.
Do you think it'll make him hear any better?
Bye-bye.
Thank you, Dr. Bolger. Come on, we've got to go make a blood test for you now.
Do tomorrow morning. No?
Yeah.
A42 or A44 or A48.
8:48, what? That'll be spot on. What? Yeah.
Which one would you like?
I'll have 8:48.
Or you can have 8:58.
That one. Then that way I ain't got to take kids to school.
OK, that's booked for you then for tomorrow at 9:58.
9:58.
8:58, sorry.
I've got to say, are you cuckoo there?
It's the computers, they frazzle your brain after a while.
I'll be here about just before 9 then.
Yeah.
Well done. See you tomorrow.
Bye.
Serena Martinez. So how can I help today?
Pain I'm going through has been, I don't know what caused it in the beginning. I've always said it's the medication. It's what, my whole body's just gone weak, and like every time I'm concentrating on something, I have auras. I can't even sit down and watch telly too long.
What have you come for today? What's...
Because of the seizures are ongoing, they haven't stopped since then. What they call clusters.
Yeah.
She's having pain in her chest.
Pain, yeah, in the back.
She can't breathe properly.
And you got an outpatient appointment on...
Yeah, but waiting, I don't feel like I can flip and do that. It's pain in my gut. Something, it feels like something's in there and it's getting bigger and bigger, but it doesn't want to come out the rear end. It doesn't want to come out my mouth. I'm burping sometimes, but it's like me forcing myself to burp. I wouldn't be here if I wasn't in trouble. I don't come to doctors unless I need the doctor.
What's the symptom you're worried about most, Serena?
Going to the toilet, I can't get anything out.
You're constipated?
Yes, and there's nothing in me.
Because she's not eating.
It's been like this for the week. So when I had the 9 seizures, and I've been trying to eat. Once I put something in my mouth, I'm going into a seizure. That's not normal. It hurts when I cry. I'm sorry to swear. I can't handle it. I can't handle this anymore.
My eyes are driving me mad. So there's some irritation somewhere.
Something's irritating you,
Something,
obviously.
yeah.
And I was going to ask for some of them little blue pills, but you won't.
Mrs. Morley has a nursing background.
Tell me about it.
So it's good to have a nurse doubled up as wife.
I love you.
I love you too, baby.
You're both off. That's nice to have a day together, yeah?
Sometimes, yeah.
You didn't hear that.
I don't know what's going on.
Have you had any change in your medication for your epilepsy in the last 2 weeks?
They gave me lorazepam when I went into hospital, and I was meant to be on clobazam.
The lorazepam you're just not taking?
No. I stopped that, I think, yesterday.
And you're stopping taking because you just don't like taking it?
No, because of the feelings it was giving me, it wasn't helping.
Would you rather have some clobazam in
I'm thinking yes, because
in
how
reserve?
it made me feel.
In reserve, in case you have a seizure?
Yeah.
Because when you used to take it, you used to be all right.
Yeah, it used to knock me out or just relax me.
But these are not to take on a regular basis. These are to take as and when, yeah? Have you heard from Chalfont?
He just rang me just now, said he's looking, he's going to get me in this ASAP.
I think what's clear is that you need to see the Chalfont consultant, because I think there's some confusion here about what actually is the medication you need for your epilepsy. There may be a bug in your stomach that's creating a lot of acid.
I think so, because something's happening. I'm not eating properly.
I want you to have blood tests, okay? Okay, which you'll have to make an appointment for Monday morning to have the blood test here, because the person doing the blood test is now not in the building. The problem with the tablet that we could use, it can interact with some of your other tablets. The complication at the moment, Serena, is there's a lot going on here, and as a consequence, you're getting an anxiety reaction to all of it as well. It's understandable, but you've got to try to find a way of keeping calm.
Can I just stand up?
Part of your problem is you're getting in a cycle of anxiety about all of your symptoms. I know, I am conscious of the fact that there is a lack of clarity about your epilepsy management and that the seizures actually are the most important presenting problem today. Let's get those results back. Let's get you seen at the Chalfont. Let's have you take this away today so that if you have seizures, you know you have confidence in the fact that you have something to take. And then we'll see you again next week. Take this.
There's nothing they can do. It's not them there.
Take it easy.
Thank you.
Cheers.
sleep. I was tired this morning though, like I woke up and I literally couldn't open my eyes. How can I help?
I'm here for my 6-week check.
Your baby's 6 to 8 weeks?
She'll be 2 months tomorrow, yeah.
Okay. And was it normal delivery?
Yeah.
Yeah. How did it go?
Yeah, no, it all went smoothly.
Did it well?
Yeah.
So any problems since you had the baby?
No, other than nothing like physically, but like I don't know. Sometimes I just feel a bit upset or whatever, or down. Sometimes I feel like I can't really not look after them. I don't know. I just sort of I'm not myself, if that makes sense. I just feel a bit upset at things and.
Is that happening every day?
Maybe not every day, but like most days maybe.
How much is it bothering you?
Well, me and my husband sometimes we might end up having an argument or whatever, and then I feel really upset. Like I got quite upset this morning, but
And is it an argument over practicalities?
it's
or...
over really simple things, to be honest. And I don't know if that's because we're both tired or if it's because I think he thinks I'm a bit more upset than normal.
I mean, if your sleep's not affected and your appetite's okay, then I think for the time being we can just see how things go. If it starts to become quite all-consuming and, you know, occurring on most days for a lot of the day, then come and have another chat about it, because it might be that you're getting a bit of postnatal depression. That can manifest itself in lots of different ways. It can be that you feel more tearful. It can be that you feel much more tired.
It has been a little while, but I haven't ever come in because I always thought, oh, it'll go soon. Yeah, I don't know.
Come in, take a seat.
Thank you.
Right, what can I do for you?
Well, unfortunately, my back has reared its ugly head again. And this time, I managed to escape from the ambulance service.
Oh, did you?
Yes, I'm working as an endoscopy technician.
Right.
Very keen to actually do the job.
Yeah.
Until I actually got there and started doing it.
And then you think that's making your pain worse?
Yeah, because it's washing scopes in a sink that is very low.
Okay. So at the moment, what's the back doing?
Sharp pinching pain around the actual spine area.
Yeah. Any radiation anywhere else?
I did have an injury at the South Central Ambulance Service, and it's on the right-hand side around
Down into
here.
the buttock, okay, into the hip, okay. No incontinence?
No.
No? Okay, no numbness, pins and needles anywhere?
No.
No, okay. Come and have a lie up here. So how long has the back been a problem for altogether, would you say?
Well, I've been managing it quite happily, even with lifting and carrying patients with the ambulance service.
Yeah.
I mean, the back has been a problem since 1984.
Okay.
And I was lucky enough to be involved in a train crash.
Oh, no. Where was that?
Would you believe it's not been documented? I can't find it. But it was the first fast train going into Paddington. And it tried going in at 100 miles an hour.
Wow.
Yeah.
Okay. Right, could you lift that up straight for me? How far can you go?
About there.
Okay, and that makes the pain worse when you go any further than that? Okay. Have a sit up for me slowly. Okay, if you can spin around this way so you're still sitting on the bed. Okay, if you pop your hands behind your back and just slowly come forward for me. So, down. I'm just going to move that leg up. How far can you go with that?
Just there, basically.
Okay. Up. You can pop those trousers back on again now. Okay, I think you need, well, a couple of things. What medication are you taking at the moment? Anything?
At the moment, I'm constantly taking paracetamol and ibuprofen.
Yeah. I might give you some paracetamol with codeine at the moment.
Just continue exercises.
I think you need to continue the exercises.
I can't actually stop moving because then I'll seize up.
Absolutely. But the underlying problem will still be there, and also the work-based problem will still be there as well.
Right.
And that needs to be sorted, doesn't it, really?
It does, yes.
Either by a new job or by them suddenly finding money to put a new sink in or a change so that you don't do that thing. And, you know, I'd be more than happy to say, yes, you can do the job, but you can't wash endoscopes in a low sink. And I can put that on a note to say, could be fit for work as long as an adjustment in duties.
All right, lovely.
Good.
Thank you very much.
Okay, mate. Take care.
Thank you, I'll try.
Watch out for fast-moving trains.
Yes.
See you later. Bye-bye.
Had you got to the stage where you thought you might need some help with some medication or some therapy, or was it?
Yeah, no, I always thought maybe talking to somebody. I don't know if that would.
Well, you can refer yourself to something called Healthy Minds.
Oh, okay.
And they can arrange for you to have some help.
Yeah.
If you feel that that's not enough, or you need a bit more help, then you can always come back in and see us here. There's no one out there scoring you for being the best mum in the world. There's no real right and wrong. You just got to be happy with how you're doing.
Yeah.
It's hard. It's very hard, especially with two. That's very good. And are you ever feeling it totally overwhelmed, or do you ever feel like self-harming or?
No.
So, are you happy with that? Are you happy to have a chat and see with Healthy Minds and see if they can offer some therapy?
Yeah.
So see how you go then. If you have any problems, just come back. That sort of thing. Okay.
Well, thank you very much.
All right, thank you.
Hello, how are you? Oh, thank you. It wasn't required though. How are things? You're looking very young now.
No, I've been in Italy.
Did you?
3 friends, 2 o'clock, we went have a snack in my apartment. We drink 3 liters wine, but only a couple of glasses. And my friend said to me, can you take this glass to the kitchen? You believe it? I went on the floor, I broke the glasses, I never cut them myself. He said to me, I went dead. I said, why didn't you call it at all? Why didn't you call my wife? I thought you drink too much. What do you mean I drink like you?
Okay.
I think my heart.
Take care.
My heart, I think, felt bad.
I think we need to do a thorough check of your heart today then. Yeah. I'm just going to quickly listen to your heart now. The heart is beating regularly, around 60 beats per minute, yeah? Just take some nice deep breaths. In and out, in and out. That's good. Thank you.
Maybe I need operation, no?
I don't think so. I'm a bit unsure whether it's related to alcohol, whether it's related to the pacemaker. But what we can do is organize a heart scan to look at the latest functioning of the low chambers of the heart.
I give a bottle to the girls. You know the girls?
Yes.
I bring the bottle of wine too.
Oh, did you? They'll be very happy.
This is my picture. Look.
That tastes really good. My wife says that. So blood test, echo scan, continue the current medications, and we'll meet back in 4 weeks' time.
I make wine now. I've been very busy for 2 weeks.
How are you? Make sure you drink in moderation because the warfarin interacts with alcohol. So when I say moderation, in your situation, just a glass.
If I drink wine Guinness, I tell you, doctor, I don't drink wine.
Do you drink daily?
No.
No.
Only water.
Okay, that's good. Keep up to it.
I used to drink that.
Take care.
See you.
Bye-bye.
Thank you.
Yeah, you're not in for disappointment in this clinic.
I'm hungry.
I am as well.
Well, you had soup.
Yeah, that's all I had. God, I'm always hungry as well.
Mind you, yesterday, I don't know what I was doing, but every time I was walking out that way, I felt as if I was losing my trousers.
Oh, God, really? That's good, isn't it?
It is good. It means I'm losing maybe an inch or half an inch or a fraction even.
Susan Dorel. Here he goes. Hello. Hi, come on in. So I've got Claudette, who's here to help you and me.
Oh, I am terrified.
Oh, please don't be.
Well, what happened the last time? I couldn't sit down for a week.
Really?
Yeah. Really.
Okay. Okay.
And the other thing I was going to ask you, someone close to me has just had a breast cancer scare, and she yelled at me and said, "You must check your breast." But I've never done it, and I don't know how to do it. So I just wondered whether you could show me how to do it as well.
Okay, so I can check your breast today, and then what it is it's more about being breast aware. So I'll show you how you can check it yourself. I just need to have a quick look at the cervix so that I can do a smear. It may be a little uncomfortable, but if at any point it's actually hurting you, then I'm not looking at your face, so you need to tell me to stop, and I will stop. You're the boss here, okay? This is not a torture chamber, so you are guiding me, okay?
Not a torture chamber, she says.
It's quite worrying that 1 in 4 women do not attend for their cervical screening tests, more popularly known as the smear test. In spite of a well-organized national cervical screening program, about 800 women die each year from cervical cancer. Cervical cancer is an extremely preventable disease. In fact, it's probably one of the most preventable cancers. So my plea to all you women out there who are due a smear test is to ask you to put your fear and embarrassment aside. It could save your life.
Things us women have to go through.
I know, I know.
I am terrified.
Are you going to be a brave boy? If you're a brave boy, I'll give you a choice of some stickers if you like.
Okay, try and relax. Well done. You're braver than you think.
That's it, put it over. Oh, you're very brave, aren't you? You're like Superman.
Oh, brave, Daddy.
All done.
He's very brave, Doctor.
You're very brave, good.
I've had surgery this year.
Oh, have you?
Kind of sailed through it flying colours,
Excellent.
actually. Anyway, I'm a brave soldier, so...
Oh, good.
You were so brave, huh?
So if you relax like you did, you're very good. Okay. It's really, you're very cooperative, to be honest.
A friend of mine said that you don't have to have them if you're not sexually active. Is that true?
Have you never been sexually active?
Well, I've had the odd boyfriend.
Then it's worth having it. Okay, so I've done the smear. Okay.
Wow. Really?
Yeah, okay. So I could see the cervix looks normal. So you wanted me to check your breast side, didn't you?
Yes.
Do you want to come in, Claudia? All right. Yeah. You've never had any breast lumps or anything like that?
No.
Okay, and the way to feel it is with the flat of your hand.
Right,
Okay. Perhaps, once a week or once a month, whenever you get the time, you can stand in front of the mirror, look at your breast, see if there's any asymmetry, is one sort of a nipple looking a bit different, any discharge from the nipple. Okay. Sit up for me. And if you feel any lump at any time, at the moment, there's nothing to worry about at all. Okay? And take a seat.
That is such a relief.
So what happens now is that you get the result, and if you get the letter and you're worried and you want to speak to me, then give me a call and I'll call you back.
Thank you ever so much for your help.
Pleasure. I'm glad we could help.
I'm so glad that it went all right. Thank you very much.
Pleasure.
Okay. Thanks very much.
All right.
Thank you very much.
All right, take care.
Bye.
I was doing this to my head, right?
You got a headache?
Yeah, I've gone really bad. These
Hug a
lights
doctor.
are horrible.
Hug a doctor.
Hug
I
a
did.
doctor?
Yeah, because they said on the television, instead of keep taking paracetamols or something like that, it says hug a doctor. So just hugging is a form of calming down, I think.
Oh, give us a hug.
But I'm not a doctor.
Oh, it's gone?
Yeah, right.
Hello. Hi, how are you?
We're not well. No, see, we're not well.
We're not well.
No, we're not well.
In what way are we not well, Malachi?
He's got a rotten cough.
Yeah, since when? When did that start?
About 3 days now.
Yeah. Mm-hmm.
He's not eating very well.
Yeah.
And he's not drinking very well either.
Okay.
But we still have had some wet nappies, so I'm not too concerned.
Yeah. Is he running round?
Apparently not.
I think this is his stock answer to every question. He'll shake his head. I'm just going to take your temperature, Malachi. It's okay.
Good.
Can we pull this Batman up? So tell me, is it true that you are actually Batman? Or are you just wearing? I can hear your chest better when you scream, you see. I can. Yeah, good.
No, you're done.
We're all finished. All
It's
finished.
all right. It's all right.
Yeah, so he's got a very mild viral pharyngitis. It's a slight viral infection of his throat. His chest is really good. He's obviously got the same virus in his nose. Ears normal, neck normal.
Can't we just take all the bugs out of my baby?
He needs those bugs to strengthen his immune system so he doesn't come down with important
He
diseases.
doesn't need an immune system. I'll stick him in a bubble. It's fine.
Oh, I see. OK. So all you've got to do, give him something like Calpol. It's going to kind of feel like this still. Same symptoms about another 48 hours. They begin to disappear at that stage. But, of course, they could come back.
We don't want them to come back. We can positive things, please.
Well, do you want the truth or do you want fiction?
No, we want facts.
Yeah, well, facts.
Bit of fiction at the end, though, yeah?
Hopefully it won't be fiction.
Rhetorical question at the end.
Oh, very good. I'm very impressed. I'm very impressed.
And a tip.
What's your top tip for today? Have you got a top tip?
To brush your teeth.
I do.
Yes, that's very good. They're really important. So important for your health to brush your teeth every day. Top tip for health. When you're feeling cold and unwell, honey, lemon, cloves, whiskey and hot water.
The one home remedy that really seems to work is that when you're feeling very sick, leave some lemonade to go flat and then sipping it slowly really helps settle your stomach.
If you've got a lot of trapped wind, peppermint's very good.
It's the cleanest it's been. Is it? Honey is really good, you know.
Good morning, sir. The weirdest tip I was given from a farmer who said that he put a rasher of back bacon in each of his socks to treat his hard feet.
When my mother was alive, she says, going into the sea with your feet is the healthiest thing you could ever do.
OK. One top tip my mum always used to give me was turmeric ground down and mixed in with warm milk. And she swore that it was the remedy for any ailment that I had.
Have you heard the expression that we've got? You should put nothing smaller than your elbow.
Yeah.
No, in your ears, yeah? No, sorry, nothing bigger than your elbow. They're not smaller.
Yeah.
So you should, in other words, you shouldn't put anything in your ears.
People underestimate the importance of getting involved in their community. It keeps you healthy, it keeps you positive, keeps you well, wards off loneliness, wards off depression and anxiety. Bye-bye, Malachi.
I'm sorry. Thank you for entertaining my thug.
You're more than welcome.
Thank you, Doctor.
You take care. Bye-bye.
Bye.
Bye-bye. So sweet.
That's it, finished. I'm done.
Very good. I'll see you later.
Thank you very much. Bye-bye.